When we think of orthodontia, we usually think of a good-looking smile, but there's so much more than that. When the mouth is out of alignment, it can cause severe pain all the way down the body. Headaches, back pain, and joint pain are just a few of the common issues that can be caused by a mouth that is out of alignment.
The reason why I came to see Dr. Johnson was because of the realization that I was having an occlusion problem. My teeth were actually being ground down in front, and I was getting them, they were starting to break off and become fragile. I knew that wasn't right.
I've worked as a heavy-duty mechanic all my life and have had considerable back and neck pain due to a severe neck injury when I was 19 years old. And I had tried chiropractic and massage and many chiropractic techniques actually, and I found that there just wasn't a technique that would keep my neck and my lower back in place.
Fatigue was my middle name, and I used a supplement, basically adrenal support supplement, to go ahead and compensate for that. So I became a supplement junkie. The dosage was anywhere from 2 to 15 a day, and I was taking 15 most of the time.
So clearly, there's a need to address more than just the cosmetic. And in this battle, there's a powerful weapon. It's called the aligner. And here's its inventor.
I'm Dr. Runner Johnson. I'm a dentist, and I've been practicing dentistry in Sequim, a little town in northwestern Washington, for about 43 years. And back in the late 70s, I started treating patients for chronic pain. People that had headaches, neck aches, back aches, fatigue, and other problems in their body. And in those days, we were making appliances. One we called a Willie May appliance. Willie May was a fellow that developed a system probably back in the 30s. And my problem with trying to treat these people was that I never knew where level was in their arches in their mouth. And so it was taking hours and hours of time to treat them. I'd see the patients every other day for 2 or 3 weeks making appliances, trying to balance the appliances. Well, in the late 80s, Dr. Carlson, another dentist that I was working in his office once a week, came across this concept of the HIP plane. That's the hamular notches in the back of the mouth behind the maxillary tuberosities and the incisal papilla. And when you look at those planes on a skull that's in the erect position, they create a flat surface that is horizontal to the floor. Now, this became very important. I realized immediately after I'd been treating people so long, without the visual aid of knowing where the horizontal was, that when this plane was created and I saw the horizontal, this is what the body needed to function. Now, the beauty of the aligner is that it's an orthopedic analyzer, so you can analyze where the arches are, whether they're level or not level, and it's a precision instrument. You can use it to test the vertical height, the up AP or front and back motion, and the lateral motion. All the scales are identical on every instrument, and they're reproducible from one instrument to another. So if you mount a case on one aligner, you can take it off and put it on another aligner. It'll be exactly the same. So you have, when you mount your mount, this pin is 15 millimeters, this rake is 15 millimeters, and you use the HIP plane, you put the model on here, put stone on here, you close it down. Now you got your model mounted on here. You have a horizontal scale right here. So if you need to change a model up and down, you can do that precision as much as you want to. You have a AP or anterior posterior area, and you've got your scale right here, so you can move it as much as you want, anterior or posterior. And then you have your lateral excursions that you can put in this by moving this, so you can check lateral excursions when you're setting teeth or you're analyzing an appliance for lateral excursions, because lateral excursions are built in appliances as well as the height and anterior posterior position of the plants when they're built to the patient's needs, not just arbitrary. And everything we do with the aligner in our treatment of patients who are in myofascial pain or other pains in the body we're trying to regulate is built on the aligner to their specific specifications. Nothing is really arbitrary, and that's been the beauty in my practice. I'm no longer dealing with arbitrary positions and theories. They all work because they're designed for a patient, for that patient's needs.
So what are the results?
The relief of that stress. It's like I don't have to carry a 75-pound bag of cement on my back anymore.
I have tried just taking out the appliance to see if I'm all healed up and can operate without it. And when I do that, I found that I'm pretty much back where I started.
That can be relief. It's incredible, the relief that is there available. And it doesn't have to be, well, we don't know or we don't care or it's not within the accepted procedures yet. The Wright brothers flew too, and it was not possible.
Truly, the aligner will revolutionize the way we think about and practice orthodontia and dentistry. The medical information contained herein is provided as an information resource only and is not to be used or relied on for any diagnostic or treatment purposes. This information is not intended to be patient education, does not create any patient-physician relationship, and should not be used as a substitute for professional diagnosis and treatment. Aligner Works LLC disclaims responsibility and shall have no liability for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information contained herein.